Dr. Lubna, good afternoon.
Yeah, hi. Please check if I'm audible and visible.
Yes, you are very much audible and the network looks fine. How are you, Dr. Lubna?
All good.
Wonderful. So, shall we start?
Yeah, why not?
Good afternoon, everyone. A very warm welcome to Author Spotlight, an exclusive series by Homeopathy 360. At BJAN, we believe that every great book begins long before it is written. It begins with years of learning, countless patient encounters, moments of discovery, and unwavering commitment to advancing the science and art of homeopathy. So, today, through Author Spotlight, we invite you all to go beyond the pages, to meet the author, explore their journeys, and discover the clinical experience and inspiration that shape the books influencing homeopathic practice around the world. It is my absolute pleasure today to welcome our distinguished guest for today's episode, Dr. Lubna Kamal, and listen from her the journey behind her latest book with BJM Publishers, that is Chronic Disease Simplified with Homeopathy, a holistic and practical guide authored by Dr. Lubna Kamal herself and Dr. Mohan Singh. Dr. Lubna is a pioneering homeopathic nephrologist and accomplished clinician, researcher, entrepreneur, and the founder of Nano Homeopathy. Through her exceptional work in the field of chronic kidney disease, she has combined clinical excellence with innovation and compassionate patient care, inspiring practitioners and patients across the globe. Our contributions continue to redefine what is possible in the specialized field of homeopathic nephrology. Dr. Lubna, on behalf of everyone, I extend a warm welcome to you on Author Spotlight today.
Thank you very much, Dr. Nooreen. Thank you very much for having me here and coming out with my book, publishing my book. Thank you. Thank you for
Many
the support throughout.
Many congratulations on your second book. Dr. Lubna, before we dive into the book, I would love to, begin with your personal journey. Many homeopaths, they pursued, general practice while you chose to dedicate your career to chronic kidney disease, which is a very highly specialized and challenging field. So what inspired that decision and how did you begin this journey? Please tell us.
Yeah. So actually, I was never keen on homeopathy, taking up homeopathy as what you can say as a career option. But then fate had other plans. So I was very scientific right from the very beginning that, okay, since I've chosen homeopathy, this is not going to be the usual practice which was prevalent at my times. Because there were very few homeopathic doctors who were actually good with their practice. The rest of them were, giving medicines for 10 or 20 rupees. So I had planned this very early, right from the very beginning, that this is going to be the practice is going to be very focused, because that is what I felt in allopathic system. It is very meticulous, it is very organized. There are no gynecologists who would give medicines to the pediatric age group or to a patient suffering a heart attack, But in homeopathy, it is always like this haphazard, and that is actually something uh, um, which has caused it not to grow. I mean, the growth has been hampered because of this. Because if the homeopathic system was more specialized, we would have come up with better doctors, and you would have published by now many more such books.
True, true, true. Having worked with thousands of patients over the years, so you have witnessed the realities of chronic kidney disease firsthand. What are some of the biggest, challenges these patients face, not just medically, but in their day-to-day life? What do you think, because this is often called a silent disease. So what has been your experience?
Yeah, actually, this is something very important, because when the creatinine rises, if suppose the creatinine value is 1.5, and for 3 months consecutively, continuously, it is 1.6, it is very hard for people to believe that more than 70% of the kidneys have already been damaged. So it is that silent and that insidious. And after having consulted with over 25,000 patients, this has been the biggest problem, because patients do not come to know when there are initial symptoms, or when the level of the creatine is slightly high. Patients usually miss it. They feel that, okay, it is just points. In decimals, it has increased. So they do not pay attention until it is very late. So the initial symptoms are usually missed because it is just the weakness, mild swelling, little changes in urination and all. So it is only when there is gross swelling and there are the disease has really advanced, then only patients come to know about this. So that is actually why we need many more homeopathic nephrologists, because homeopathy has great role. I'm sure we are going to discuss it further in detail.
Absolutely. Absolutely. I hope through this podcast, young homeopathic practitioners and already those who are practicing will be encouraged to, pursue something like this. Dr. Lubna, with such extensive experience that you had, uh, what made you feel that this is the right time for me to write down a book on chronic kidney disease simplified with homeopathy? Were you hoping to fill any gap, or did you feel the need that some book should be addressed?
Oh, yes, of course. There was absolutely great need, because each and every day I would come across at least one prescription of a quack homeopathic doctor, something which I've acquired in last 25 years. I don't know how the rest of the homeopathic doctors are treating patients of kidney failure, and treating acne and hair fall and IBS at the same time, because I have it has taken me 25 years to learn, unlearn, and then relearn so many things, to have now been come up with a book, or now to be able to handle a patient with kidney failure. So that is actually what was very frustrating, that the homeopathic doctors around me, the patients would come to me and then they would say that I had been taking homeopathic treatment from last 1 year or 2 year from this doctor or that doctor, or even from homeopathic medical college, and nothing improved, and they missed the tests, actually the very crucial tests. That is the part of the management. And there are other homeopathic doctors who would stop the existing allopathic treatment, that is the modern medicine, which is not at all advisable. The patient is dependent on it from last 10 years or maybe 15 years. And the doctors would start giving Robolfia in place of, Nicardia or Telmisartan, which
Right.
was great blunders. So that is why I had to, come up with this book, so that the future generations, at least, they are guided better. They know
Yeah.
what to do with the patient when if even if they do not want to be a nephrologist or homeopathic nephrologist or a specialized practice, at least they know what to do with a patient suffering from CRF if that patient lands into the clinic.
Right. Very well said, Dr. Lubna. Uh, would you like to share any unforgettable case, that shaped your thinking towards kidney patients? Although you have mentioned in the book, which readers can read, tell us about a way that your philosophy changed and your approach changed.
Yeah, so there are four cases. If you give me enough time, I'd
Absolutely.
like to discuss all four of them. So the first, actually, I've dedicated the book to my cousin, and he was suffering from nephrotic syndrome. We used to be childhood friends, and then all of a sudden, I came to know that we cannot play together because he's having recurrent fractures. So then later I came to know that because of that nephrotic syndrome, because of those excessive steroids, his bones become weaker and weaker, and that is why he has been disallowed from playing, because he'll get fractures. So that is something that was very shocking to me. It was childhood. and I could not do anything about it at that time. But then it remained at the back of my mind, and somehow he inspired. That was actually the initial inspiration. And then in the beginning of my practice, I actually interned at with lot of senior doctors, Dr. S.M. Singh sir, Dr. Girish Gupta sir, Dr. Zaidi was my mentor in Allahabad. So I was constantly seeking answers, especially related to my cousin's illness. And then in the initial practice, there was a patient from Mr. Bola Singh from Bihar, and his attendants actually came to me with with his reports and all. He was admitted in Paras Hospital, Patna, and none of the organs of the patient were working. He had kidney failure, liver failure, lung failure, heart failure. None of the organs were working, and I was not able to understand what should I even do with this, with this kind of. And it was very beginning of my practice, 2007 or 8. And then, okay, then what I did that, okay, I took the case in totality and came up with the constitutional treatment. He was very particular, like Amrish Puri kind of a person, very much lycopodium. So I gave that lycopodium, and then I gave something based on pathology. And then the patients went, the attendants went away, and they gave the patient the medicines. Unfortunately, I do not have the reports and everything. And the patient was in coma as well. He was on a ventilator. So the patient, the medicine was administered somehow, and then the patient started to recover. And he came out of the coma, he came out of the ventilator, he was eventually discharged. Then at that point of time, I had a clinic in Patna. I used to be there for a day in Patna. So he came to meet me, and since the lift was not working, he walked to the first floor. He through the stairs, and that was it. So I decided now that this is something actually I actually want to do, and then I became focused and more focused. And there are two more cases, if you allow me later, then
Absolutely.
I'll definitely discuss it. There was a patient who had very severe UTI, and she was going to be dialyzed. The patient came to my clinic from that nephrologist from that big hospital, that big corporate hospital, that the doctors have said so, and you just have to do something. Don't let my patient undergo dialysis. And it has been like 4 years, no dialysis, and her creatinine is like near 2. So this is something which lot of homeopathic doctors can do, and lot of kidney patients can be saved. And one last case, is there a patient of suffering from transplant? Sorry, he had underwent transplant, and then it got rejected. He's a young chap working in Gurgaon, and now the whole world came, crumbling down in front of him, that I underwent transplant, I spent so much of money, and now even that is not working. So what should I do? Because the doctors have, the nephrologist at the hospital had told him, you start dialysis and prepare for the second transplant. Get another kidney, get more money, and just go ahead with that. So that patient too, I think it's been 3 years, and he is absolutely fine. He is working in Delhi, the kind of environment, the kind of pollution, surviving all of that. And his creatinine also is very stable. He is also doing very good. So these are the cases I just
Absolutely
wanted.
inspirational, very inspirational coming from you. Dr. Lubna, with all these decades of treating these renal disorders, how has your perspective evolved as a homeopath? Considering that allopathy can have wonderful efficacy in renal disorders. And also, what do you believe that every practitioner should understand before approaching these kind of complex cases?
The most important thing is the knowledge of modern medicine. Actually, the practice of medicine, the pathology, the physiology, which most of our us homeopathic doctors actually we skip. We study it for the examination, and after that we feel that it is not so important for the practice, because whatever the patient is coming to us, we just have to either we have to prescribe through therapeutically, or we have to give some similar medicine. and that is it. No, but if you have to manage such complicated diseases, not just kidney failure, liver cirrhosis, liver failure, respiratory failures, there are a lot of cancers. You have to have in-depth knowledge of the modern medicine, which is the most essential thing to do. Then the next important thing is that while you are studying, I keep on telling my students to actually, like just the way I started to practice, like attending doctors right from the first year. I tell my students to at least go to some nursing home, get the knowledge of the modern medicine, or be with a homeopathic doctor, so that you are able to, because in the initial years of the practice, these kind of patients won't come to you. And
Yes.
if they come to you, then you do not know what to do, because we are so nervous, in the initial years of the practice, such patients coming with lot of swelling, urination, vomiting and all. So but the homeopathic doctor is very nervous to what to do, and then they miss the important points. So, in the 5 years, each and every homeopathic student, they should attend hospitals. They should be with as many homeopathic doctors as possible, as many teachers. You have to sit with them, understand their prescribing. The more, the merrier. And
Absolutely.
then after, once you are done with that, I always tell my students to divide their practice into three parts. There should be one, this thing which should be charity based, where you get lot of patients who come to you for free, so that you get more and more experience. You are prescribing it yourself, and you know what is happening with your medicines. The second thing is, of course, your own practice. The third thing, if you have time, then I ask my patients to join somewhere as EMO or RMO to learn modern medicine better. Because if you have to like deal with these kind of cases, you need to be equipped with everything: the knowledge of all allopathic medicines, the knowledge of the machines, the knowledge of the diagnostic test, which as homeopathic students we miss in the 5-year course. It is not very well emphasized, and that is something I feel that even for my students, I feel that they too missed lot of things. So that is how handling such kind of cases only can be there with experience, not with just the books. Of course, the books are there to guide this homeopathic book based on homeopathy. Then the books which are there on the practice of medicines and all, they are there. But when you see those things practically, then only it will make absolute sense.
Yes, that is very crucial as a practitioner. Dr. Lubna, there are many misconceptions also. We may have, common layman people also in our audience who would listen to you. Misconceptions related to the role of homeopathy in kidney disorders, especially, patients who are already undergoing dialysis. How this book will address these questions, and what should practitioners understand about managing these dialysis patients?
See, I have tried to put everything in the book that is needed to handle a patient. But yes, of course, you need to know your limitations. That is the first thing, where at which point of time you have to tell the patient to undergo dialysis or to transplant or to go to a hospital. All right. And that again will come with experience. And the book actually, when once you go through the entire book, you will be equipped how to deal with the patient homeopathically.
Yes.
Of course, the management part is also there, but the most important thing is homeopathically what can be done and how should it be done, in what manner. So this is a complete guide. If somebody makes a thorough study of this, the chapters are very simplified. There are different sections, and with actually while reading these books, if you start consulting those kind of patients, then it becomes more clear. uh,
Yes.
Things will become more clear to you once you are, because this is a book, and what you're going to do in the clinic is the practical thing. So both the things will go hand to hand. And I'm planning a course also, as I discussed with you earlier also.
Okay.
So, which because MD in this PG in homeopathy in nephrology or uronephrology, I think it will take some more time. So till then, the students or the doctors, they can make use of the book.
Absolutely. This is the right time that we should delve into these subjects and, tighten our belts for the future.
No, actually, there's a lot of work to do in the field of nephrology alone. I mean, that is true with the rest of the chronic diseases as well. But if you speak to me about nephrology, there are so many patients dying out, every single day. They go to the government hospitals, they are without the beds. They just wait there lying on the floor. Today in the
Yes.
morning itself, there was a patient from Basti. He came to my clinic at 6 a.m. in the morning.
Oh.
And they had, put a chadar on the this outside, there was this footpath, and they were lying over there. So
Mhm.
this is the state of affairs. In India, there is never going to be the doctor, actually, the doctor and patient ratio it will be very long before this gets equated. Yeah.
Yes, yes. As someone who has pioneered, work in this field, what do you see is the future of homeopathic nephrology over the next decade? What areas of research, education, or clinical practice, like you said, you believe need greater attention?
I see a very bright future for homeopathy and especially for this specialized homeopathy, for homeopathic nephrology, for homeopathic hepatology, and whatnot. So there is absolutely, this is a virgin field and there is so much to do. There was sometimes back I had a call from Ministry of Ayush asking for all the details of the work I've done because there was some question raised in the parliament on the issue. So I gave them whatever I could, but they were like that, okay, you have done so much and you have so much of data, but they could not find it in the rest of India. They could not, they were looking for data everywhere and they could not find it everywhere else. So that is why I was saying that there is immense need for studies in all these specializations and especially nephrology. So I gave them about this inputs about the book, about whatever I had published earlier, the cases and the research papers. They were satisfied, but they were very disturbed to know that such thing why hasn't it been done by anyone else, or why not at this scale anywhere else?
Absolutely.
So that is why this book becomes even more important, because when we move ahead in the field of health, and especially after COVID, the people know about Ayush, people know about homeopathy, and now they want to have homeopathy, but we do not have that many good doctors.
Yes,
That is how, and that is where the specialization becomes very important, because now the
absolutely.
patient has everything at their fingertips. They have Google, and now they are even advanced, chat GPT and everything.
True, true,
So
true.
you have to be at par. The knowledge has to be like way ahead. You have to know much more than what the patient already knows. They will ask
Absolutely.
you so many difficult questions, and then only you will be able to justify your fee. That is, why many homeopathic doctors, we are not, as homeopaths, we are not able to charge the fee, because we are meddling up our practices.
True, true, true.
Whereas if you are able to counter every question that is, bold at you, if you are able to answer it well, just like a modern medicine counterpart, then I think the patient would happily pay you whatever fee you feel like.
Absolutely, absolutely. That's very encouraging as well as motivating how our practitioners should be. Dr. Lubna, this is your second book, the first being Homeopreneur with BJan Books. And that book offers a unique perspective on building a successful homeopathic practice. And now you have come back with a very comprehensive clinical work on chronic kidney book. How has this journey been with BJan practitioners? Tell us something about that.
Oh, I'm absolutely, I'm absolutely in love with BHM because these are the books I have been like reading from eternity. My father used to read some BHM books based on homeopathy, very initial. When I was a child, my life was saved because of homeopathy. So that is how he became inclined. So from that time, like I was 4 or 5 or 6 or 7 maybe, from that time onwards I have seen the Bijan, the so I it's
Love.
my honor that Bijan agreed to publish my books. They had faith in me, and my experience have been absolutely wonderful at each and every step. You all were so helpful, Manish and Dr. Panpalia. Everybody has been very helpful and very encouraging, because without your encouragement, I mean, the whole team, was so encouraging. It would have been just in my mind, and I would have never been able to, write and come up with this. So, Bijan, right from my childhood, I have been reading these books on homeopathy. And then during my studentship years, Bijan has always been a part. So it's an honor for me. Thank you so much, Nidhi.
We are delighted to have you on board as our esteemed author. Audience, a quick note for you. If you have any questions for Dr. Lubna related to the book, related to her work, please put them in the Q&A box and we'll try to take her insight one by one after this discussion. Dr. Lubna, one last question I would like to take before we allow you to, take your presentation. If there is one message that you would like to, say to fellow practitioners or students or reader who are going to read your book, this is the book written by Dr. Lubna and Dr. Mohan Singh. What is the takeaway that one will have after this book? Please tell us.
Uh, the homeopathic doctors and the students who are going to go through this book will never look back, and they will find themselves equipped with dealing with the patients suffering from chronic kidney disease with ease, with confidence. And the most important thing is that now, after this book, I feel that they will start thinking about specialization, maybe in nephrology or maybe in several other subjects, and maybe later on they will come up with their own books to guide our generations better. And homeopathic medicine is the medicine of 21st century. We actually, this is a virgin field. There is so much to be done. So this would be a very small initial step, I would say. And our future generations, maybe they will make better use of the book, and make better use of the idea behind the book.
Yes, wonderful. Uh, we have a question from Mr. Saigal. He's asking, what are your upcoming goals for nano homeopathy and kidney healthcare? Would you like to
Oh,
share?
absolutely. There is so much to do, and there is no time. I feel that miles to go before I sleep. So we'll be soon launching the course, as I told earlier, on based on nephrology. Then we are working on another book on dreams, which I hope that Vijan uh, would like to publish. So the dreams are very important, and prescribing based on dreams, it's very simple, it's very easy, and you can find simulum within minutes. So you don't have to take out so much of time in the busy practice for this case taking and all. Then we have already so many. We are running 5 charitable clinics, where which is being managed, which are being managed by the junior doctors, the students, and the doctors who have just graduated. And we are planning to come up with more branches of the charitable clinics, as well as our main clinics all over India, so that the patients who do not have uh, money, they also are benefited, because there are so many patients we can help with homeopathy. And then, just like Dr. Batra, I feel that he has done a wonderful job in homeopathy. So we will be coming up with more homeopathic clinics as well, where the doctors, the young graduates who feel that there is no money. So I want to break that perception. There's huge amount of money in homeopathy if you just are willing to work hard.
Perfect, perfect. Another question is from Tej Prakash. He's asking, is homeopathy does homeopathy work in chronic kidney disease patients with eGFR 65? That's a very
Yeah, I like to take that. Actually, what was his name?
Tej Prakash.
Mr. Tej Prakash, actually, eGFR is estimated GFR. That is not the real GFR. It is a calculated value where you put the value of the creatinine and the age and certain other things, and that is in a mathematical formula, and that will give you the value of eGFR, which is the estimated GFR. Now, this is not the real GFR. The real GFR is done through a very specialized test, and it is not something which can be repeated very frequently, because the tracers and the radioisotopes which are used that can cause some problems. So the creatinine value, actually, it is not something related to kidneys, rather than, but it is something related to muscles. The more you are walking, the more you are running, the more creatinine is being produced. So if you go by that eGFR formula, then the creatinine would be high and the eGFR would be low. But that won't be the real GFR. So my advice would be to whatever reports you have, you share it with some doctor. They will be able to advise you better, because the size of the kidneys, the rest of the parameters, there are a lot of things which actually help us with the course of the treatment. And eGFR 65 is absolutely fine to start homeopathic treatment, because I have patients with GFR, the real GFR and the estimated GFR as low as 10, below even 10. So even those patients have improved. See, I'm not using the word cure, because there are some diseases which can only be managed. The quality of life, the parameters, the reports, the rest of the things, they can be managed, they can be improved. So definitely eGFR 65 is nothing for homeopathy. The patient can definitely improve.
Great. Dr. Lubna, we have another question from Ms. Sangeeta. She's asking, what is your approach to CKD patients? If you can brief up in short.
Yeah, actually, that is something very, very important, because both the things are equally important, the modern medicine as well as the homeopathic part, which I each and every day, my team, we have 4 or 5 doctors, and I keep on telling them that without constitutional medicine, you cannot reverse CKD, and you cannot manage. You can just stabilize it with the homeopathic medicines, with the pathological prescribing, the eel serum, the epicynum, the apis and all. You can just stabilize. But if you want to actually to reverse that, if you want the kidney size to improve, if you want the creatinine to come down to normal, or maybe the reversal from grade 4 to grade stage 1, then you need the constitutional treatment, and both go hand in hand. So the pathological prescribing as well as the constitutional prescribing, both will go hand in hand. The pathological prescribing, of course, depends on the pathology, the symptoms whatever the patient's problems are at present. So you can replace, like if the patient is having a lot of nausea and vomiting, you can give colchicum or ipecac. And you can make taper off the allopathic medicines they are taking, because these the PPIs, the Omaze, the Pantop, whatever medicines are being given by allopathic doctors to bring the appetite back to normal or to stop the vomiting and all, our homeopathic medicines work better. But you have to be gradual with the approach. And once the patient is okay, you withdraw those medicines, let the patients be on constitutional medicine alone. And the constitutional medicine, regarding the constitutional medicine, no matter what the patient comes, no matter what the state the patient is, there are always some general symptoms, some mental emotional symptoms, some dreams, or maybe some fears, which the patient or their attendant will be able to tell, and you will be able to prescribe. So never go without the constitutional medicine.
Absolutely. Anonymous attendees asking, what achievement are you most proud of and why?
No, there hasn't been any such achievement that I should be proud of. No, that has way to go. Maybe sometime when the parliament, there is that, okay, now we will be having homeopathic medicine in all the dialysis centers. Maybe that will make me proud someday, but not at the
Wonderful.
moment.
I hope you find this a recognition very soon. Dr. Shalini is asking, can you mention some specific medicines that have helped you in, these cases?
Yeah, actually, I have it there in my PPT. So the constitutional medicines, I have found arsenic sulflavum to be very useful, rubrum, arsenic sulfrubur, arsenic album. Then natrum I found to be very useful. Of course, the symptom totality should match, and you have to pay attention on the thermals of the patient also. So then the Cyretia and Hepersulf in autoimmune disorders, and sulfur also in autoimmune conditions. So these are the few of the constitutional medicines. And then if you speak about pathology, then there are, I mean, almost everyone knows about them. The Epicynum, Apis, Zingiber, eel serum. There are a lot of medicines like that.
Yes. We'll take one last question by Dr. Santosh Reddy. He's asking, does the book consist of the general management plans or the treated cases? So,
The general management plan, of course, because each case is different. So once you go through the entire book, you will be able to deal with the patient of kidney failure, and it will give all the outlines where actually the doctors fumble. They at times they do not know what to do, what when the phosphorus is high or when the potassium is high. It is actually a guideline to it. So once you read the book, once you start treating those patients, then of course the path will become more clear.
right. Dr. Lubna, I'm sharing the screen. Are you able to see the slide?
Oh yes, the author spotlight one. Yes.
Yes, yes. So I'll carry forward with this and you please begin with your presentation. Audience, if you have any questions later also we'll take, and Dr. Lubna will now share her highlights of the book.
Yes. So this is a very easy to understand guide to CKD, that is the chronic kidney disease, and it combines the clinical experience, the patient education, and everything you can think of. Next slide, please. Next. So this is me and my co-author. Next, please. I'm glad that Dr. Rajkumar Sharma, he is the leading nephrologist of India, and he was ex HOD and director of SGPGI Lucknow. He agreed to write a foreword for the for this book, and we have been like in touch from last 15 years, and he has been following my entire journey. So I'm very thankful to him, and it is a big achievement for a homeopathic doctor to have such an endorsement from such a senior nephrologist. Next. So there are 4 sections in the book. Initiate the first section where you understand the kidneys and the kidney diseases, and this is very important because, as I told you earlier, treating these kind of patients actually without learning about the physiology, the pathology, and the practice of medicine, it is not possible. So you don't have to read the entire Gray's Anatomy and Guyton's physiology. But at least the most important things have been covered over here. Then the modern medical management, as I told earlier, that you have to be aware of the medications, the procedures that are there for the supportive care, the management part, so that you can guide your patient, because then only actually that is the very important thing, that we do not refer the patients and we do not ask the patients to undergo dialysis, creating, some as if it's some kind of a monster. No, it is a life-saving procedure. And when it is needed, and the homeopathic doctor, they should ask the patient to go to a hospital and get themselves dialyzed, because saving the life is more important than just to keep on giving homeopathic treatment. And the section 3 is about homeopathy and how holistic kidney care helps. So the individualized treatment approach, that is, I've already told several times that it is actually the most important thing. Then the holistic healing and the patient-centered care, everything related to homeopathy in the section 3. And the section 4 has, it's very interesting, comparison and research and future perspectives. And we'll keep on adding to this. This is not the end. Of course, there are many more things which will keep on cropping, and we'll keep on adding. So why this book? Because it is, I feel that this is the area where a homeopathic doctor can do a lot. Preservation, not just replacement. Next slide, please. So CKD is one of the leading global health challenges, while the heart problems and the cancers are supposedly little reduced. The chronic kidney disease is rising everywhere in the world, especially in India. So we'll need many, many more nephrologists in coming years. Next, please. CKD will become the 5th leading cause of death by 2040. So you can just imagine, just now it is 16th, and in 2040 it will be the 5th leading cause of death. Next, please. So there are end-stage renal disease. Alone, there are 260 patients per million population, and out of them, only 6 are getting treatment, while 254 patients are waiting for death. So here is where, for these 254 patients, homeopathy can work wonders. Next. This is the vicious circle in which the patient is trapped forever. Without homeopathy, there's dialysis, then which leads to protein loss, which leads to water retention. Then there is a high protein diet is recommended, which leads to raised urea levels, which again leads to dialysis. Next, please. So here is where homeopathy enters, and it can break this vicious cycle and take the patient out. This slide is very important. Chronic kidney disease, where the renal function has deteriorated for more than 3 months, at least 3 months, because I get doctors who share reports with me that the creatinine was 16, and within a month it came down to 1. So I tell them, why don't you apply for Nobel Prize? Because what you have treated just now is just acute or chronic kidney disease, not the chronic kidney failure. Because the renal function has to be disturbed for more than 3 months continuously, then only it is called chronic kidney failure. So these are the very important things which are important for a homeopathic doctor. We do not get this kind of information while we are doing our PG or UG. Next, please. Everything is there in the book. So modern medical management, which is the section 2. Next, please. These are the stages of renal failure, and with homeopathy, even the stage 5 patient, that is the end stage kidney failure, it can be brought down to stage 3A or stage 2 and even stage 1 in some cases. Next, please. And it is a big achievement. Even if the creatinine is not absolutely normal, the kidney size does not return to normal, then too it's a huge achievement. So how does modern medicine deals with the kidney disease? All of these things the homeopathy can do. That is the early detection, control of blood pressure, medications to slow kidney damage, dietary. All of these things can be done by a homeopathic doctor, except for management through dialysis and transplant, for which we have to send the patient to an allopathic doctor. Next, please. So renal replacement therapies, we have already discussed. Next. Allopathic medicines, each and every medicine is very important for you to understand, because whatever medicines the patient is taking, like the BP medication, it causes lot of thirst. So the thirst won't go by arsenic or phosphorus or sulfur, because it is being caused by the antihypertensive medicine the patient is taking. So what you have learned through the BHMS, you have to learn a little bit, because you have to learn about the allopathic medication and its their side effects and when to reduce them. Next, please. Section 3, it's all about homeopathy, how to approach the case, and you have to focus on the whole person rather than the kidneys. Next, please. So these are the principles of homeopathy, which I think all the homeopathic doctors, they already know. And the minimum dose, the law of the similars, this is actually what creates the edge for us homeopathic doctors, the law of similars and the minimum dose, because that is why homeopathy becomes the safest medicine on earth to treat such chronic conditions like kidney failure or liver cirrhosis, cancers, etc. Next, please. So definitely homeopathy can reduce dependency. I have several thousand patients where dialysis has been reduced and stopped, where the transplant has been averted, and even the post-transplant patients are there. So you can be absolutely sure if you purchase the book that yes, definitely you can help such patients with such conditions. Next, please. Bridging the gap between conventional and holistic kidney care, because there are never going to be enough of nephrologists and enough of dialysis machines or transplants. There will always be patients in India waiting for treatment. So this is where the homeopathic medicine can bridge the gap, and we as homeopathic doctors, we can do wonders. Next, please. Homeopathy versus allopathy. See, we cannot do without allopathy, but yes, there are a lot of things that only the homeopathic medicines can do. And I've already discussed that the minimum dose, it is the least harmful medicine. So it can be very safe with the patients of kidneys. But yes, you have to be a little careful with the tinctures. Don't overuse tinctures. Scientific research and homeopathy, we are going to have this virtual conference on kidney diseases on World Kidney Day 2027, and where we'll invite abstracts from all homeopathic doctors as well as from all the Ayush fields as well as the nephrologists. So the notices will appear very soon, and there is a lot of scientific research which as homeopathic doctors we have yet to do. And I hope in my journey you all are together with me, and you all of you are welcome to share your stories and everything. So taking charge of your kidney health, this is something very important. When a kidney patient comes to you, then you can share this with them. Next, please. The results, this is a short study of 1,121 patients. Out of them, 783 patients were available with proper follow-up, and almost 80% of them showed positive improvement, because in nephrology, we take status quo also as improvement. Next, please. Next. So these are the frequently used constitutional medicines. Natriumur was on top because for most of the cases of blood pressure, natriumur is indicated. And such patients with blood pressure are actually land up with kidney failure. Next, please. These are some of the other medicines, Staphylis and Cantharis at the bottom. They were very useful for kidney failure due to UTI, recurrent UTI, which is very common among women. So all of these medicines were found to be very useful. Next, please. This is the case I was talking about. He underwent transplant in 2023, and it has been almost like 3 years. He is absolutely fine. Next, please. Next slide. We'll just quickly go through this. He had transplanted. Previous slide, please. It is showing the graft kidney. You can read the last line. The graft kidney. No, something is written. I can't read that. Next, please. Initially, the creatinine was 6, where he was asked to undergo dialysis and prepare for transplant. This is the February report, and he was given sulfur. Next, please. Based on the totality, he was prescribed with sulfur. This patient was also prescribed with sulfur. She was a 72-year-old female, and it was long back she came to us for treatment. Next, please. So the initial creatinine was again around 6.9. It was in 2021. The patient is still with us. Next, please. Look at the number of pus cells. This was the usual report. And the later report. Next, please. Next slide. Okay, the last slide. The last reports are not there. The creatinine for the second patient is around 2. The slide is not there. So sulfur was given. So I'll conclude by saying that homeopathic treatment shows marked improvement in the quality of life. That is the very first thing. And it slows the progression of disease. It's reduced the number of dialysis, and indicated homeopathic remedies help to postpone the urgent need of transplant. Next. So we were awarded for consultation with the maximum number of patients. We have treated the maximum number of patients worldwide suffering from renal failure. Next, please. This is about the management and screening. We keep on holding these screening camps where we check the patients. Next, please. So thank you very much. That is all for today. If there are any more questions, I would like to take them up.
Dr. Lubna, we have a couple of more questions. Repeatedly, Dr. Sangeeta is asking, please tell about posology. So if you can quickly give some idea.
Okay. So actually, for if you speak about the constitutional medicine, I use most 90% of the times I use 50 millisnum. And if you speak about the pathology, the medicines are mostly in 30 or sometimes in tinctures. That's it.
Right. What an inspiring conversation with you, Dr. Lubna. A heartfelt thank you for all your service to the human, people who are suffering with such difficult malady. And also thank you for sharing with your expertise and your passion and purpose behind this wonderful book. If today's discussion has inspired you even a little, don't end it here. Pick up your copy of the book, Chronic Kidney Disease Simplified with Homeopathy, and explore the wealth of clinical experience, practical insights, and real world case learning that couldn't be possibly fit into just one conversation. After all, the best discussions spark curiosity, but the best books help you to master it. Thank you for being with us, Dr. Lubna, once again. Thank you, audience, for your active participation. Dr. Lubna, before we sign off, anything you would like to say?
Thank you very much, Dr. Noori, Mr. Manish, your whole team for bringing out this book and making it happen. Thank you.
Perfect. So this is Dr. Noori, Senior Editor at BJAN, signing off today. Until then, keep reading, keep healing, and keep inspiring. Goodbye, everyone.